For patients with psychiatric conditions, coronavirus is a huge problem because of exacerbation of existing psychiatric conditions and also because of the change in lifestyle that comes with the coronavirus. For instance, people with depression are suffering a lot from isolation. They had difficulty before in connecting with other people, and now that is even more difficult than it used to be. So there are people that are developing more severe symptoms. There are people that don't have the type of access to mental health care that they used to have before, or there are people that are so worried about getting an illness that refuse to go in contact with their health care providers. So people with psychiatric illnesses many times are at much higher risk of paying huge consequences for these epidemics. There is a risk of suicide that is increased, and for sure there is a risk of a dramatic loss of quality of life. Again, it's important that we keep in contact with our patients, that we call them if we cannot see them. If possible, we should have video calls, so we should have telephone calls. It's important that we stay in contact with them because isolation is not what they need. We need to make sure that if they are receiving medication treatment, they continue receiving medication treatment, that they have a way to get their supply of medication. If they have poor adherence and they have illnesses like bipolar disorder or schizophrenia, we should consider using long-acting antipsychotics, long-acting medications. We should consider sending our nurses to their home in order to increase the likelihood that they receive the medication and provide them with all the help that we're able to give them.